Hello dear aspirants, welcome to KNO Academy. So today I have come with total 100 MCQs from NORCET-9. Okay, so some of the questions and some of the answers may be different from the original paper because these are from memory based questions. Okay, memory based only. Okay, so not from the exact paper from AIMS because AIMS won't give the paper or any answers to the examinations. Okay, so these are the memory based questions. Okay, we will move to the first question. Okay, so when examining a patient who is paralyzed below T4 level, okay, the medical surgical nurse expects to find. So here actually I am not going to waste the time because everyone already knows, so I'm going to explain only important topics and also important questions came from KNO Academy app and KNO Academy YouTube channel and also KNO Academy WhatsApp. Okay, and also only important answers only I'm going to explain. So all four options no need to explain. Okay, so here we'll read the options: flaccidity of the upper extremities. Okay, and hyperreflexia and spasticity of the upper extremities and impaired diaphragmatic function requiring ventilator support. Okay, and independent use of upper extremities and efficient cuff. So this is the right answer. Okay, so this is the right answer. Why I will tell you, because this upper extremities will be supplied from the brachial plexus. Okay, so which is formed by C5 to P1 spinal nerve. Okay, so below T1, okay, below T1 will not affect the upper extremities. Okay, below T1 will not affect the upper extremities. Okay, and also patient can use the thoracic muscles. So the right answer is independent use of upper extremities and efficient cuff is the right answer. Okay, so this same class explained from the Akhil sir. Okay, in KNO Academy app. Okay, in app you can go through the NARCET demo classes. Okay, in free classes it is there. Okay, so that is the upper motor neuron legends and also lower motor neuron legends. Okay, so here they are written. Okay, plasticity and flaccidity. Okay, so lower motor neuron always with the flaccidity, upper motor always with the plasticity. Okay, so for the complete video we can watch in KNO Academy app. Okay, so next question is the anaphylactic shock. So this is the question number 2. Okay, so anaphylactic shock is an example of, okay, so hypovolemic, obstructive and cardiogenic and distributive. So the right answer is the distributive shock. So here Nagraj sir taken class in KNO Academy app. Okay, so here we can see the distributive shock. Okay, distributive shock is example of the anaphylactic shock. Okay, same thing sir has explained. Okay, so next question. So this is the question number 3. Okay, so give nitroglycerin 15 microgram per minute. Okay, so this is the dosage they have to. Okay, we have to give the 15 microgram per minute. Okay, nitroglycerin is mixed. Okay, 50 mg in 500 ml D5 water. Okay, what rate on the infusion pump in ml per hour will deliver the correct dose? Suppose we have to keep the ml per hour. How many ml per hour we have to keep to deliver the 15 microgram per minute of nitroglycerin? Okay, this is the question. So this question I have explained around 9 months ago. Okay, in YouTube channel. So you can see here. Okay, same. So I have explained the dopamine calculation. Okay, same formula. Okay, desired dose divided by into quantity into time in minutes. Suppose if they are giving the patient body weight, we can enter the patient body weight. Okay, and divided by available dose into 1000. 1000 is for the microgram. We have to conversion. So I will solve this question. Okay, so here, so same I will write. Okay, desired dose. Okay, desired dose into quantity. Same formula I have explained. Quantity into time in minutes. Time in minutes divided by Okay, available dose. So suppose if they given dopamine, dobutamine, NORAD, everything, we can use this formula. Okay, available dose into 1000. So 1000 is for the microgram. So here we will calculate. Okay, desired dose what we want, we need 15 microgram per minute. Okay, into quantity is how much? So we have diluted in 500 ml. So 500 into time in minutes per 1 hour, that is a 60 minutes, divided by available dosage is 50 mg. Okay, 50 mg into 1000. Okay, so here what I am do, I will cancel all these three zeros. Okay, this one zero and this two zero. Okay, canceling. Then what will, okay, 15 into 5 into 6 divided by 50. Okay, so here we can see that is the uh, 15 into 30 divided by 50 is equal to 450 divided by 50. Okay, this zero will cancel. This 5 ones are 5 nines are. So 9 ml per hour. So we need to keep like this. So this fluid calculation formula is very, very important. Okay, I have explained all the IV fluids, okay, dopamine, dobutamine, all the drugs I have explained in the YouTube channel. Okay, so the right answer is 9 ml per hour. Okay, everyone has done this. Okay, so this is the example. See, 9 months back I have done in the KNO Academy YouTube channel. Same you can watch. Okay, and in a state of sedation during a continuum for a mechanically ventilated child, the conscious sedation. This also Akhil sir has taken in the KNO Academy of conscious sedation. Another name. Okay, another name of the conscious sedation. Okay, that is the moderate sedation. Okay, conscious means moderate sedation. Okay, mild. So we are giving only that what we are called that local anesthesia something. Okay, deep sedation will be complete deep. Okay, and general anesthesia. So here we can see. So that is the, so what is the grades he has given. Okay, so you can watch the video to understand this. Okay, so the right answer is moderate sedation. Okay, and we'll move on to the next question, that is the okay, identify the type of chorionicity based on the image given below. So this question just one day before examination I have explained in the KNO Academy YouTube. Okay, so this is, so whether dichorionic monoamniotic pregnancy or monochorionic diamniotic, monochorionic monoamniotic, and dichorionic diamniotic. So the right answer here I will show. Okay, monochorionic. See, same example I have given. So this is the same picture. That is the monochorionic monoamniotic. Okay, so this is the dichorionic di. This is the dichorionic diamniotic. This is the monochorionic diamniotic. Okay, so this is the monochorionic. Okay, monochorionic and monoamniotic pregnancy. So option C is the right answer. So we'll move on to the next question. So which is the weekly use contraceptive pill? So weekly we are using. So now we are using only Chaya. Okay, Chaya is the contraceptive. Same thing I have explained in the KNO Academy app. Okay, app, and also even I have shared the notes also. All the groups I have shared the community notes. Okay, here we can see that is okay, same notes. This is written by me only. So send Chroman. Okay, that is called Chaya. So initially we will start with a twice a week for 3 months. After that, once a week. Okay, this is a non-steroidal oral contraceptive. Last time they have asked with a non-steroidal contraceptive example they have asked. Okay, this time they have asked weekly contraceptive, that is the Chaya. Okay, here we can see the name Chaya. Okay, so we'll move on to the next question. Under the Universal Immunization Program, okay, UIP, how is the rotavirus vaccine administered to infants? Okay, so option A, 5 drops oral liquid formulation, 2 drops oral lipolyzed formulation, 0.5 ml intramuscular injection in thigh, and 1 ml subcutaneous injection in upper arm. So this is blindly we can write that is the rotavirus is a liquid vaccine we are giving the orally, that is the 5 drops we are giving. Same notes I have written in the KNO Academy. Same class is given in KNO Academy app, and also notes I have shared in the KNO Academy app. So here we can see the oral vaccination. So we are giving the rotavirus, and also so here we can see 5 drops mouth rotavirus. Okay, so hope you understood. And next question, identify the congenital anomaly shown in the image. So gastroschisis, meningocele, omphalocele, and extropy of the bladder. These three, okay, examination previous day, these three I have explained. This I have not explained. So if you watch that video, definitely you will go with the extropy of the urinary bladder. Okay, so here we can see same thing I have explained. So this is the meningocele. Okay, this is the omphalocele. This is the gastroschisis. Okay, so policy everything I have already explained in the same video. Okay, so next, the vaccine is used for the prevention of which condition? Okay, so this is very easiest one. So this picture image based we have already shared many times in the groups or subgroups. Okay, and also Akhil sir also explained in the class. Okay, so this is for the cervical cancer. Okay, so then here we can see Akhil sir explains the this Gardasil. Okay, so most common vaccine for the cervical cancer. And next we can see, okay, so identify the disease in the image. So this is the clinical sign of the Kawasaki disease. Okay, simply don't waste the time. So strawberry tongue, strawberry tongue. If they ask question in word, what is the strawberry tongue seen in Kawasaki disease? So here we can see just yesterday we have shared the same image in the WhatsApp group. Okay, so here we can see Kawasaki disease, strawberry tongue. Okay, then a woman in labor have 5 centimeter dilatation. Okay, and -1 station and 40% effacement. So which is the stage of labor? So this is also I have explained just one day. Okay, so here the right answer is the active stage of labor. According to who WHO labor care guidelines, labor care guide. Okay, so the right answer is active will be 5 centimeter dilatation. So here same picture we can see in the KN Academy YouTube. Okay, that is 3 weeks ago I have done this. Okay, according to who labor care guide. So active phase of labor stage being in a 5 centimeter of cervical dilatation. Same question I have explained. Okay, then which maneuver used first for the shoulder dystocia? Okay, so this also just day before examination I have explained. Apply fundal pressure. Okay, assist with McRoberts maneuver, juvenile maneuver, and suprapubic pressure. So this is the assist with the McRobert maneuver. Okay, same thing I have explained in the YouTube. Here we can see same. The first will be shoulder dystocia. Okay, first will be McRoberts maneuver. Okay. And next, which of the following best represent the late clinical sign of head injury? The classical triad known as Cushing triad. Okay, so options tachycardia, hypotension, shallow breathing. Okay, and bradycardia, widened pulse pressure and irregular respiration. Okay, tachypnea, hypotension, bradycardia, hypertension, bradycardia, and tachycardia. So the right answer is bradycardia, widened pulse pressure, and irregular respirations is the right answer. So the same notes we have shared in the WhatsApp channel. So here we can see the decreased heart rate, bradycardia, irregular respirations, and widened pulse pressure. Okay, so I think who are all not following, they might not aware of this. Okay, so then we'll move to the next question. A 30-year-old pregnant woman at 38 weeks of gestation with a history of her BP is 160 by 110 mmHg, proteinuria 3 plus, diagnosed as eclampsia. Eclampsia means we should understand there is a convulsions. Okay, so I have done very beautiful class in KNO Academy app convulsions. Okay, eclampsia, and also Akhil sir also dealt this. Okay, so what is the best management? Best management is the injection magnesium sulfate and immediate delivery. Once convulsion starts, we should not wait for the delivery. Okay, we have to deliver the baby at any stage of pregnancy. Means irrespective of gestation, we have to deliver the baby. There is no wait for the after convulsions. Okay, so after once conversions comes, we have to delivery immediately. And the drug of choice for eclampsia is the injection magnesium sulfate. How much dose we have to give, everything I have explained in the KNO Academy. Okay, this notes also we can see. Okay, hypertension, this kills are also explained. Okay, regarding the eclampsia. Okay, this is, see, first one is the antihypertensive we need to administer, anticonvulsants and delivery. Both at a time we have to do. Okay, this we have done in KNO Academy app. Okay, and a patient with history of psychiatric disorder is begins to act overly dependent on nurse and says, "You remind me of my mom." Some questions I saw, you remember like you did like my sister like that. Okay, you remind my sister. So exact word I don't know. So both we can consider here. So what psychological concept is this? This is the, see. Suppose if nurse, okay, okay, here patient, okay, feelings towards the, okay, nurse is transference. Okay, transference. If nurse feelings towards the patient is counter transference. This Praveen sir did in the, okay, counter transference. Okay, so this is the right answer, transference. Okay, so Praveen sir has did this. Okay, transparent and counter transference. Okay, Praveen sir has did in the KNO Academy class. So next, a 35-year-old man with schizophrenia, okay, schizophrenia, is started on haloperidol. Days ago, few days later, okay, he developed sense of inner restlessness, inability to sit still, okay, and constant pacing. So, what is most likely diagnosis? Option A: tardive dyskinesia, B: akathisia, and acute dystonia, and neuronoptic malignant syndrome. Tardive dyskinesia means, okay, it is the involuntary movements, okay, involuntary movements of the body, okay, and akathisia is the same, okay, like inner restlessness, inability to sit still, constant pacing is the akathisia. So right answer is akathisia. Acute dystonia is the involuntary muscle contractions, okay, and neuroleptic malignant syndrome is it is consist with the fever, okay, muscle rigidity and autonomic dysfunction. Autonomic dysfunction. Okay, so the right answer is akathisia for this. Okay, who are all done this, you will get a 1 mark. Okay, so akathisia same. So all the class I have added only simple screenshots. Okay, so all classes I have done in the KNO Academy app. Okay, the next question. Identify the ECG arrhythmia pattern. So we have shared many times in the KNO Academy WhatsApp groups and also notes also, and also classes, and also YouTube also I have taken the same image. Okay, so this is the supraventricular tachycardia. Okay, this is not the bradycardia, this is not the tachycardia, this is the supraventricular tachycardia. Okay, the same question. See, here Akhil sir also asked the same image with, so that is the SVT he asked. Okay, and also I have taken like, okay, what is the treatment for this arrhythmia? Okay, that is the whether vagal stimulation and also for the adenosine vagal stimulation. So we can done for this SVT. Okay, so this we have done in the YouTube. Okay, you can see with the YouTube channel. Then, which is the live attenuated vaccine? So, live attenuated vaccine, blindly we can write this. That is the MMR. Okay, MMR is the right answer. Okay, not DPT, not PCV, not influenza. So, this also we have given the notes in the KNO Academy groups. Okay, this class uploaded in the KNO Academy app. So, this live vaccines we can see here. So, that is the measles, mumps, and rubella. Okay, so then we'll move on to the next question. The telephone number 1800891441 or 14416 is associated with which of the national government service? Okay, so this many people has confused, but the right answer is the Telemanas. Okay, that is from the Niman, Bangalore. Okay, just okay, 1 week back only I have shared this image in the KNO Academy WhatsApp channel. So you can see this 10th September. Okay, 10th September World Suicide Prevention Day. I have shared this image. Okay, you can see that Telemanas and also number. Okay, who are all both on this? They have answered right. Okay, So hope you understood. Okay. We'll move on to the next question. Which of the following is best to differentiate the surveillance from the epidemiological research? This also I have done in the class. Okay. So survey. So the right answer is here only the option A. Surveillance is systematic, whereas research is aimed at generating new knowledge. So this we know. Okay. So this simply no need to waste the time. So here we can see that I have written the surveillance. I have explained in the class. Okay. So the epidemiology. Okay. Surveillance, everything I have explained in the class. And here we can see the a 28-year-old pregnant, okay, G2P1 gravid to para 1 woman at 32 weeks of gestation presents with the sudden onset of severe abdominal pain and vaginal bleeding. On examination, her uterus is tense and tender. This keep this two words in your mind. Okay, one baby bradycardia and another baby's absent of FHR. Okay, what is the most likely diagnosis? Placenta previa, no. Abruptia, placenta, yes, right. And uterine rupture, no. Okay, ectopic pregnancy, no. Okay, so this is the abruptio placenta. I will tell you. So Akhil sir has clearly, beautifully explained in the class. Like here, see, here we can see abruptio placenta. Here, see, fence tender. Okay, these two words, keywords for the abruptio placenta. You can keep. This class is available in the KNO Academy app. Okay, and a patient is assessed using the mini mental status examination. This is very familiar question, very simple question, everyone know this. Okay, MS score, that is the 19 by 30. Which category does the score fall into? Okay, so whether normal cognitive function or mild cognitive or moderate cognitive or severe cognitive. So this is the moderate cognitive impairment. Okay, moderate cognitive impairment. So Praveen sir has done this class. Okay, mini mental status examination, and also he has included the image. Okay, so here we can see the 10 to 19 is for moderate and 20 to 25 is for mild and 36 to 30 is for questionably significant. Okay, 0 to 10 is a severe. Okay. And next, a 16-year-old girl is diagnosed with borderline personality disorder (BPD). Okay, which of the following is a typical characteristic of BPD? Okay, that is a borderline personality disorder. So the right answer is unstable interpersonal. So I am not wasting the time because so already everyone knows right answer. Okay, so who are all not done from our group students. So for them only I am doing the video. Unstable interpersonal relationships and fear of abandonment is the right answer. Okay, unstable interpersonal relationships, okay, and fear of abandonment is the right answer. Okay, so this also explained by private sir. Okay, borderline personality. Okay, this is available in the KNO Academy app. Okay, and then a patient taking lithium for the bipolar disorder develops new muscle weakness, coarse tremors, nausea, and drowsiness. What is the nurse's priority action? Okay, so it's taking lithium. So what should be done immediately? Suppose if in the option they have given stop the next dose, means that is the stop the next dose, stop. Okay, and also we have to assess the serum lithium level immediately. If maybe options may be missed here. Okay, assess the serum lithium level immediately. Okay, so this is enough for the serum. Okay, so encourage fluid, so this won't work. Okay, and continue we cannot continue once. Okay, if cross the therapeutic we cannot continue the lithium. Administer anxiolytic, no, this won't work. Okay, this won't work. And restrict sodium intake and monitor intake output. Sodium should not be high and should not be low in the lithium therapy. Okay, it should be given thoroughly. Okay, equally we have to give. Okay, so this also class. Okay, given Praveen sir also done, given Nagaraj sir also done. Okay, Nagaraj sir done in the same MSN class, that is a like pharmacology he has done with the lithium class. Okay, so even Praveen sir also done with the lithium therapy. Okay, two classes available in the KNO Academy app. This is, I think this is available in the KNO Academy YouTube channel. Okay. And next, a patient's laboratory report shows serum potassium of 6.3 milliequivalent per liter. The doctor order intravenous calcium injection, that is a calcium gluconate injection. What is the nurse's priority action? So administer calcium injection over 10 to 15 minutes and monitor for arrhythmias. Administer calcium as rapid IV bolus. Okay, hold calcium and repeat potassium after 1 hour, no. Okay, this also rapid we cannot push. Okay, and give oral calcium and potassium binder, no. This is for not for the potassium. Okay, then here we can give the administer calcium injection over 10 to 15 minutes. Okay, that is a 10 ml calcium injection. Okay, 10 ml, 10 percentage over 10 minutes. Over 10 minutes we have to give. So this also class taken by the Nagaraj sir. So we can see the injection calcium gluconate. Okay, same class available in the KNO Academy app. So Nagaraj sir taken this class. Okay, then next, the same here given. Okay, over 10 minutes. Okay, slowly. Okay, slowly I will push over 10 minutes. Okay, so next question, the newborn of 1 week after giving 2 cycle of compression and ventilation showing the heart rate of 52 beats per minute. The neonatologist advised to administer the injection adrenaline. Okay, what is the dilution for injection adrenaline according to the NRP newborn resuscitation program? 1 ml adrenaline in 9 ml NS. Okay, 0.1 ml adrenaline in 9 ml NS and 1 ml adrenaline in 10 ml NS and 0.01 adrenaline in 0.9 ml NS. So the right answer is the adrenaline 1 ml in 10 ml, sorry, in 9 ml of NS. That is 1 ml plus 9 ml. Okay, that is 1 is to 10,000. Okay, this is the right dose for the. See, this also we have shared in the 5th September 2025 in WhatsApp channel, and also Nagaraj sir also done the same class. Okay, so we'll move on to the next question. The next question is after a tonsillectomy and adenoidectomy. Okay, tonsillectomy and adenoidectomy. What nursing education should be given to the mother of the child? Okay, observe frequent swallowing. Okay, encourage vigorous gargling. Allow the child to resume normal activity without restrictions and give spicy and hard foods. No, this is not, this is not, and this is not. Should not encourage. Okay, so we have to observe the frequent swallowing for the why we are observing, so to assess the hemorrhage. To assess the hemorrhage. Okay, so same question asked by the Nagaraj sir. Okay, in KNO Academy app. So we can see the same option. Okay, the next ABG shows pH 7.50, PaCO2 17 mmHg, and HCO3 is the 22 milli equivalent. What is the interpretation of this ABG? So this ABG is respiratory alkalosis. How? So this pH should be 7.35 to 7.45 is the normal pH. Okay, and PaCO2 is the 35 to 45. HCO3 same 22 to 26. So this is the normal one. So here this is low. Okay, and this also low. So this is the respiratory alkalosis uncompensated. So this is not compensated. Okay, this compensatory mechanism explained by Nagaraj sir very beautifully in KNO Academy YouTube channel. You can check it. This video, same video. Okay, so same video we can see the compensation sir has explained. All 1 hour class is there. Okay, from the ABG. Okay, the next question. What is the main reason for hyperkalemia in CKD? Hyperkalemia in CKD. So this also explained by the Nagaraj sir in ABG class. Same. Okay. So the increased dietary intake of potassium, no. Decreased renal excretion of potassium due to reduced glomerular filtration rate, GFR. Okay. Then increased cellular, no. Okay. So same we can see here. So CKD, sir has explained CKD and AKI both he has explained. Okay. Same thing. Okay. You just watch the video to understand that. Okay. So right answer is the decreased renal excretion of the potassium. And during a non-stress test NST, fetal heart rate FHR accelerates by 15 beats per minute at least for 15 seconds, occurring 3 times during the test. Okay, what does the indicate? So whether it's reactive or non-reactive, suspicious or not interpretable. So this is the reactive NST. So you can watch the video in KNO Academy app. Okay, so class done by the Akil sir. Okay, so here we can see the 15 beats per minute in 15 seconds. So this is the reactive. Okay, same class as done in the same OBG rapid revision class is available free in KNO Academy app. You can watch that videos. Okay, and then next a 6 to 72 months child calorie and protein intake according to ICDS revised norms. Okay, so this is a 300 kilocalorie and 8 to 10 gram protein, either 500 kilocalorie and 12 to 15 gram protein. Okay, 800 kilocalorie and 20 to 25 and 600 kilocalorie and 80. So this is the right answer. 500 kilocalorie and 12 to 15 gram of protein. So same thing we have explained in the this notes. Okay, so here we can see that is the C 500 child. Okay, 500 and 12 to 15 gram of protein. Okay, these notes I have shared in the KNO Academy WhatsApp groups notes, and also this class is done in also KNO Academy app. Okay, same thing we have explained. Okay, and the patient is admitted to the ward during duty. A nurse begins to react emotionally. Nurse begins to react emotionally to the patient based on her own personal experiences rather than patient needs. Okay, here the word you just okay clear. Okay, own personal experience rather than patient's needs. Okay, which of the following behavior demonstrates counter transference? I told you previously same transference and counter transference. So counter transference is nurse feeding towards the patient. So that is the sharing personal stories, which is the patient is the right answer. Okay, and next same thing. Okay, so Praveen sir has explained. So next question: an obstetric maneuver used in assisted vaginal births to deliver the aftercoming fetal head. Okay, so this word should not remember. Okay, should not forget. Allowing the baby's weight to descend. Okay, allowing the baby's weight to descend, then grasping the feet and sweeping the fetal trunk. Okay, so abdomen to help the head extension and deliver. So the same words I had told in just one day before the examination. Okay, that is the Burns Marshall maneuver. Okay, Burns Marshall maneuver. So here we can see the Burns Marshall maneuver. Same sweep. Okay, after coming head of the bridge. Same words I have used. You can watch the video. Okay, in KN Academy YouTube channel 4 days ago. Okay, the next question: a patient with hypertension and diabetes mellitus presents with the metabolic acidosis. Okay, metabolic acidosis, very important, and arterial blood gas shows normal pH. Normal pH. Which electrolyte should be the nurse monitor and manage carefully? Sodium, no. Okay, potassium. Yes, potassium is the right answer. Whenever diabetic patient is there, so we have to assess for the potassium. Okay, so this phenomena. Okay, so yeah, Nagaraj sir explained in the video. Okay, same potassium is the right answer. Then a patient presents with an inhalational injury. Okay, following a fire accident. The patient is hypoxic and respiratory distress. What is the most appropriate oxygen therapy for this patient? Okay, so in already fire accident is there. So fire accident means he may okay inhaled so much of carbon dioxide. Okay, so for this we need to give non-rebreather mask. Okay, non-rebreather mask, how it will work, everything I have explained in same KNO Academy WhatsApp channel, sorry, YouTube channel. Okay, same okay phenomena I have explained how it works. Okay, so why we are using non-rebreather mask? Okay, you can watch the video. So the right answer is non-rebreather mask. And the next question is: a patient is brought to the operating theater for a planned craniotomy. Okay, for a planned craniotomy during sign-in check. Sign-in. This is the surgical safety checklist. Okay, the nurse realized that the surgical site has not been marked. What is the nurse's priority action? Same thing I have explained in the just one day before the examination. Surgical site, sorry, surgical safety checklist. So here we can see the proceed with the surgery after verbal confirmation from the surgeon. No. Okay. Stop the procedure. Okay, and ensure the surgical is correctly marked before proceeding. So surgical site is Okay, surgical site is correctly marked before proceeding. And ask the patient relative for surgical site. No, this is not encouraged. And start anesthesia and confirm surgical site. No. Sign in means we have to do it, okay, before induction of the anesthesia. So here I have explained, okay, sign in. Okay, see here also I clearly explained the sign in procedure. Okay, because all things they will ask in the examination. Okay, the same thing, same, just one day before the examination you can watch the video. Okay, so sign in means site marking is essential for which of the operations. Suppose for the cranium also this the surgical site marking should be done, because left side, whether left side or they are doing right side, we should know. That's why surgical site should be marked. For the nasal, okay, surgeries, that cannot be marked. Okay, so this I have explained, you can watch the video. Okay, and also sign out procedure also many things are done by the nurse, that also I have explained. Okay, during the timeout also, okay, that is the before skin incision, that also what all are the things to be carried out by the nurse, everything I have explained clearly. Okay, and next question is, the nurse is reviewing the laboratory reports of a patient receiving chemotherapy. Okay, which finding requires the immediate nursing action? Okay, immediate nursing action is the hemoglobin 8 point, okay, that is normal only. Sorry, platelet count is 18,000 into 10 to the power of 3, okay, microliter, and WBC 4,500, okay, neutrophils 2,000. So the main is the thrombocytopenia. Okay, thrombocytopenia, okay, decreased level of platelets. So this should be, okay, immediate management, immediate action. Okay, why? Okay, bleeding tendency will be there, we all know. Okay, so we have to consider on the platelet count. Okay, the next question is, a fetus is diagnosed with single umbilical artery. Okay, the single artery disease is not associated with which of the following condition? Okay, which of the following condition? So single artery will not be associated with the esophageal atresia. Other than that, all three diseases it will be there. Okay, so not association is very important. So esophageal atresia is the right answer. Okay, the next question is, which of the following is a sign of adequate breast milk intake in the newborn? Which of the following is a sign of adequate breast milk intake? Adequate breast milk intake in the newborn. So the right answer, baby crying after the feeding. So suppose if baby is crying after the feeding, no, it is not adequate. Okay, then wet diapers of 6 to 8 within 24 hours. This is the right answer. Okay, continuously crying after feed. So this is also wrong. Crying at night. This is also wrong. Okay, the next question is, which of the a patient admitted, okay, a patient admitted in emergency room who is experiencing hallucinations, okay, agitate and has irritating nasal septum, okay, as reported by his friend, okay, who is also mentioned that, okay, he has ingested some substance just 1 hour ago. Okay, which substance is most likely responsible for this? So the right answer is the cocaine. It can be linked to the agitation, irritation, nasal septum, everything. Okay, the right answer is the cocaine. And the next question, a nurse is caring for a patient, okay, post endoscopic retrograde cholangiopancreatography, that is the ERCP. The patient reports severe radiating abdominal pain, has board-like abdomen, and don't forget this, and temperature of 103 Fahrenheit. Then the nurse highest priority are, okay, so this administer the prescribed analgesic for pain relief? No. Okay, notify the healthcare provider immediately? Yes, this is the right answer. And reassess the patient? No. Okay, encourage the patient to ambulate the relief gas? No. Okay, the right answer is notify the healthcare provider immediately, because this is, okay, complication of the surgery, that is the peritonitis. Peritonitis, high grade fever also is there. Okay, and board like abdomen is there, so this is a peritonitis. Okay, and next question is, the psychiatric patient, okay, repeating the same phrase again and again. For example, I want to go home, home, home. Okay, this phenomenon is called, okay, so option A perseveration, okay, option B verbigeration, echopraxia and echolalia. Echopraxia is the involuntary repetition of the imitation of another person movement. Okay, echopraxia is the movements, repetition of movement from the another person. Okay, movements. Echolalia is the repetition of words from the just opposite person. Okay, that is the uh, repetition of words. Okay, repetition of repetition of words spoken by someone. Okay, so verbalization is the right answer for this. Verbalization is the repetition of sounds without apparent purpose. Okay, so are a communication intent. Okay, perseveration is the repetition of the particular response. Okay, particular response. Perseveration is a response. Okay, and which is by a word or praise anything. Okay, or by a gesture. Okay, so the main this one I think yeah, Praveen sir did the class. Okay, that is the see beyond the point of relevance. Beyond the point of relevance is important. Okay, that is the response beyond the point of relevance means without like irrelevant. Okay, beyond the point of relevance. Okay, so the right answer is verbigeration. Okay, right answer is verbigeration. Okay, so then next question same you can so this class is available in the KNO Academy app. Okay, so a mother is positive for chlamydia trachomatis at delivery. Her newborn is asymptomatic. What asymptomatic is the very important word. Okay, and what should be given to the baby to prevent ophthalmia neonatal caused by chlamydia trachomatis? This is very important. Options are oral erythromycin 0.5% eye ointment, tetracycline, okay, 1% ointment, silver nitrate 1% ointment. Okay, so this right answer will be oral erythromycin. Okay, oral erythromycin 50 mg per kg per day for 14 days. We are giving this is the standard guidelines. Whether erythromycin eye ointment will be given for the gonococcal conjunctivitis. Propyl. Okay, this silver nitrate not applicable. Okay, so right answer is the oral erythromycin. The next option, next question: a 36-year-old woman old woman presented with secondary amenorrhea, point out, okay, and FSH is high, okay, and karyotype is shows, okay, 45x0. Okay, what is the most likely diagnostic? Okay, this is the Turner syndrome, and Klinefelter syndrome will be 47XXY. Karyotype for the Klinefelter syndrome is 47XXY. Okay, one extra chromosome will be added in the Klinefelter syndrome. Okay, so the right answer is the Turner syndrome. And this identify the image. Okay, what is the this image based question asked in the KNO test series? KNO test series. Okay, so identify the image. What is the most likely diagnosis? Okay, so this right answer is the Bartholin abscess. Okay, so for the right answers, I'm not wasting the time. So I'm moving fast. Okay, Bartholin abscess. Okay, an image shows a nurse applying pressure to the mother's lower abdomen during the first stage of labor. What is the nurse doing? So right answer is the giving fundal pressure. Okay, giving fundal pressure is the right answer. Okay, assisting with control contraction or control contraction will be done with two hands. Control contraction means we are giving pressure. Okay, this control contraction will be doing like this. Okay, counter traction with the traction means we are pulling the we are pushing up uterus and pulling down the this umbilical cord. So that is controlled contraction. Okay, applying uterine massage. So uterine massage will be done like this. Okay, so assisting perineal massage. So this is also not. So the right answer is the giving fundal pressure. So I think everyone done this. Okay, a 30-year-old man, okay, with a history of bipolar disorder in a manic episode, okay, complains that his food is poisoned and refuses to eat. This also question asked in the KNO test series. Okay, so this is also commonest question and also repeated question. Okay, what is the most appropriate initial interventions? So the right answer is the allow the patient to consume packed food. Okay, or food from the unopened containers. Okay, so there is no doubt. Okay, this is the right answer because he will doubt if you are giving open food means he will tell that you are added a poison to the food. That's why we should not give like that. So we have to give unopened boxes and we have to give packed food to the patient. Okay, bipolar, especially for the bipolar disorder and manic. Okay, next question is the what is the immediate management of the septic abortion? Septic abortion, they have asked a question. So septic means sepsis will be there. So the right answer will be fluid resuscitation and antibiotics. Fluid resuscitation and antibiotics. Okay, immediate uterine evacuation. So immediately we cannot do the uterine evacuation will be done, but the immediate will be fluid resuscitation because of sepsis. Okay, because so in sepsis BP will be low. Okay, so we have to give the fluid resuscitation and also broad spectrum antibiotics. Or see the next question, the next options immediate uterine evacuation, monitor vital signs, no, not applicable. Only antibiotics also not applicable. We have to give the both. So this is the right answer. And the next question is what is the priority nursing intervention? Okay, in the first 24 hours after admission of the client with a thrombotic stroke. Okay, thrombotic stroke means okay, cholesterol level, okay, pupil size, okay, and pupillary pupil size and pupillary response, bowel sounds, echocardiogram. This is also not required. Bowel sounds also not required. Cholesterol level also not required immediately. So the main thing will be pupil size and pupillary response to check the increased ICP, increased intracranial pressure. Okay, so we should check the pupil size. Okay. The next question, which of the following statement is not true regarding the anti-D? This question we discussed in the KNO Academy groups. Okay, anti-D, okay, that is the Rogham immunoglobulin. So in first trimester abortion, 50 microgram of anti-D is given. Yes. Okay. After normal delivery of a RH negative, sorry, RH positive baby, okay, 100 mg, okay, 100 microgram of anti-D is given. Yes. Okay. And 300 microgram of anti-D can be neutralized 30 ml of fetal RBCs. Yes. Okay. And here 300 microgram of anti-D is given after the abortion in the first trimester. No. Because the right answer is first trimester we are giving 50 microgram. Okay. So the right answer is the option D is the right answer. Okay. 300 mg of microgram of anti-D given for the abortion is the right answer. Okay. Then we'll move on to the next question, that is a 26-year-old woman presents with the vaginal bleeding, okay, 2 weeks after uncomplicated vaginal delivery. Okay, after an uncomplicated vaginal delivery, her vital signs are stable and she reports no fever of on for smelling discharge. Okay, what is the no fever or no foul smelling discharge? Okay, what is the most likely cause of her bleeding? So whether retained products of conception, atony of the uterus, vaginal laceration or coagulation. Coagulation will be, so if bleeding will be seen immediately, so this is right, this is wrong. And vaginal laceration, this also bleeding will see immediately. Okay, atony of the uterus, so this is, it won't happen after 2 weeks. Okay, so retained products of conception, it may be retained placenta, retained placenta. Placental bits will be okay missed in the uterus, so it may causes the bleeding. Okay, a dementia patient Suddenly, catastrophic condition starts screaming, crying, and pushing away. Okay, staff during morning care. What is the most appropriate initial nursing intervention? So option A is the use non-stimulating environment, touch to make the patient calm. You cannot touch the patient, okay? And use physical restraints to prevent the injury. No, okay. And administer sedatives immediately. No. So the right answer is the use non. So environment should be non-stimulant. Okay. So this is the right answer. And next question, a 4-year-old patient is brought to the emergency department after accidentally ingesting kerosene. Okay, he is coughing, okay, and has mild respiratory distress. Which of the following is the most appropriate step regarding the gastric lavage? Regarding the gastric lavage, they have asked. So gastric lavage is contraindicated or provide high follows position, and gastric lavage can be done. No, lavage cannot be done, okay, because of more chances of aspiration. Okay, so we are not giving the gastric uh, we are not doing the gastric lavage, and gastric lavage is contraindicated. Yes, this is the right answer. Gastric lavage is the, yeah, it's contraindicated. A woman came with the complaints of severe abdominal pain and diarrhea, vomiting during abdominal assessment. Okay, during abdominal assessment, inspection has been completed and signs have been noted. Inspection done now. Okay, inspection is done. What should be next? So here, what manner we are doing the abdominal examination? So usually we are doing the inspection, palpation, percussion, and auscultation. Whenever we are examining the patient, okay, inspection, okay, palpation, percussion, and auscultation, right? We are doing this manner. But in case of abdominal pain, we should not follow this manner. We have to follow like inspection, auscultation, percussion, and palpation. Palpation will be last. Okay, so here we can check the option palpate all four quadrants for tenderness. No, we cannot palpate. Okay, auscultate bowel and vascular sounds. This is the right answer. Perform percussion, no, and check for rebound tenderness immediately. So with this we are not doing. Okay, so in case of abdominal assessment, we are doing inspection, auscultation, percussion, and palpation. This is the manner. Okay, this is normal. Okay. So hope you understood. The right answer will be auscultate bowel and vascular sounds. Next question. So which of the following position is the most effective in prompting the lung expansion, okay, and preventing the post-operative atelectasis? So supine position with head flat, no. Prone position, okay, and pendulum birth position and high Fowler's position. So the right answer is the high Fowler's position. Okay, we are giving the high Fowler's position for the post-operative to prevent the post-operative atelectasis. Next question is, a patient with severe acute pancreatitis is intubated and mechanically ventilated. Okay, a ventilator settings are FiO2 100%, PEEP 12 centimeter of water, and the patient has bilateral lung infiltration and chest X-ray with poor oxygenation. Which is the most appropriate immediate intervention to improve the oxygenation? Option A is the place the patient in prone position. Increase tidal volume to improve the oxygenation. No. Decrease the PEEP to avoid the barotrauma. No, it won't happen now. Okay. And stop the FiO2 immediately to prevent the oxygen toxicity. No, because patient is still struggling. Okay. If you are reducing the FiO2, his condition will be more worsened. So right answer will be place the position in prone position. Okay. I think you may people have seen during the ARDS. ARDS best position will be prone position. So you think prone position H1N1 patients, okay, the H1N1 patients intubated, okay, we have given, okay, previously like prone position. Even COVID-19 patients also we are given prone position. Why? To expand the lung. Okay, if you are giving prone position, lungs will be expand more. Okay, so we'll move on to the next question. A patient with no previous history or exposure of tuberculosis is given a Montex test. Okay, tuberculin skin test. By which route this test is administered? Very, very simple. That is the intradermal. Okay, even first standard students also will tell this intradermal. Okay. The next, when measuring the blood pressure, if a cuff is that too small, okay, on a patient, how will BP reading affected? That is the reading will be falsely high. Reading will be falsely high. Okay. The patient is started on intravenous hydrocortisone. Okay. Which nursing action should be performed after administration? Assess blood glucose level, encourage high sodium diet, withhold fluid intake, monitor for hypokalemia. No. The whenever we are administering the corticosteroids, assessing or monitoring the blood glucose level is very, very essential. So the right answer is blood glucose level. So whenever we are administering the, you should keep it in your mind. If we are administering steroids, okay, so glucose will be high, glucose will be increased. We'll move on to the next question. Under the Indian government's national program for prevention and control of non-communicable disease, okay, non-communicable disease (NCD), who are all working in CHO, they are very familiar with this. Okay, which age group is primarily targeted? Which age group is primarily targeted? Answer option A: 30 years, 18 years, 45 years, and all the above. All the above we cannot give because 18 years are not involved. So the right answer is the 30 years is right answer. Okay. And next, in the emergency department, 20 victims arrived after an accident using start triage. Okay. Identify which patient should be classified as red. Okay. Means immediate priority. So in triage we can see the red, yellow, okay, green, and black. So black means death. Okay, so this patient only OP patient we can see this. Yellow means so moderately, okay, and this is very severe, okay, or urgent, okay. So this is urgent, okay. This is uh, like moderate emergency. Yeah, okay. So here we can see uh, a burn patient with total body surface area 80%, vital stable. Okay, so this will go yellow. Okay, a patient with pinpoint pupil and breathing difficulty. Breathing difficulty always come with the red. So this is the right answer. Okay, this is the right answer. Cardiac arrest with no pulse, no, and patient with fractured arm walking. So it will go on the green. Okay, so if he no pulse means so it will go to the black. Okay, and next, so a patient is scheduled for intravenous pyelogram (IVP). Okay, after being NPO for 8 hours, the patient reports thirst. Means is he want water. Okay, the lab report shows the time they have done the blood report. The serum osmolarity is 300. Okay, and serum sodium is 155 milliequivalent. So this is normal, and this is okay. 155 means high, but the urine specific gravity is normal. So this point we should know. So the right answer most likely nursing interpretation will be because of fluid restriction. The thirst is expected due to the NPO. Okay, so sodium is high means we have to give water. So normal sodium will be 135 to 145. Okay, so the normal, so because of thirst only, okay, because of fluid restriction, okay, NPO, that's why he is feeling thirst. So the right answer is the first one. Okay. The next question, a person with long lasting diabetes, okay, left calf pain, okay, that worsens with walking. Okay, this is very, very important and improves with rest. Okay, the left foot feels cool, looks like pale compared to the right. Okay, and the monitor progression of the problem. Which nursing assessment is mostly appropriate. So here we can see the assess nail bed color and palpate the distal pulse, dorsalis pedis or posterior tibial in the left leg. Okay, so this is the right answer because so this is a hallmark hallmark sign of peripheral artery disease. Peripheral artery disease, that is PAD. So that's why we are giving checking the nail beds. So the right answer will be this. Okay. Then a patient undergoing hemodialysis develops hypotension. Okay, blood pressure falls from 120/80 to 78/50. Okay, so this is very, very sudden drop. Okay, and what should be the nurse's priority action? Priority action. So here stop ultrafiltration, that is UF. Okay, and place patient in supine position. Elevate legs. Yes. Okay, and decrease the ultrafiltration. No. Okay, administer antihypertensives. No. How we will administer the antihypertensive? No. This is sorry. This is the wrong. And continue dialysis as planned. No, we cannot continue the dialysis. So the right answer will be stop ultrafiltration and leg can be elevated to improve the venous return. Okay, to improve the venous return to the central organs. Okay, so we are giving the head up. Sorry, limb up, leg up. Okay, so right answer will be A. After a sore throat 2 weeks ago, okay, a patient presents with cola colored urine, okay, periorbital puffiness and hypertension. ASO titer is elevated. Okay, this is very, very important. Which organism is most likely responsible for the post streptococcal glomerulonephritis? So post streptococcal glomerulonephritis cause, okay, that is a group A, gram positive beta hemolytic streptococcus. Group A. Okay, always group A. So this is the right answer. And next, a patient who was hospitalized after a suicide attempt. So after a suicide attempt shows sudden improvement in mood and behavior after 2 weeks of a patient care. Okay, what should be the nursing officer's primary consideration at this stage? Okay, so we'll see the option A. Patient may have developed the workable plan for the another suicide attempt. Yet, if he's showing improvements, he's telling that yeah, I'm fine now. Okay, I want to go home. It will tell like this. Okay, so but inner feeling, okay, inner what he planned, he's planning another suicide attempt. Okay, the patient is completely safe. Okay, no, this cannot be done. The patient no longer requires a psychiatric monitor. Yes, he required, but this is a wrong answer. The improvement is due to resolution of problem in his job. No. So the right answer is problem. Okay. Patient have developed a workable plan for the another suicide attempt. So right answer. Next question is a patient develops fever post surgery. The consultant prescribes antibiotic according to the antibiotic stewardship program. Okay, what should be the most appropriate nursing action? The option A is the administer antipyretic only. Option B is the withhold antibiotics and send appropriate culture sensitivity test before starting the antibiotics. This is the right answer. Okay, we have to send the blood culture or urine culture before starting an antibiotic. So wherever you go, this is the standard protocol. Okay, give antibiotics immediately, no. Okay, increase fluids, no. Okay, we have to take the culture first. Next, a patient with gestational trophoblastic disease, that is a GTD, is under treatment for the past 3 months. Okay, now she is present with vaginal bleeding. Okay, and serum beta HCG levels are found to be rising instead of declining, it is rising. Okay, she visits the midwife for evaluation. What does the clinical picture indicate? Normal course of disease? No. Gestational trophoblastic neoplasia? Yes, this is the right answer. Gestational trophoblastic neoplasia. Okay, PPH no, molar pregnancy regression no. Okay, right answer is the gestational trophoblastic neoplasia. And then next question is a 14-year-old girl presents to the gynecology outpatient department with the primary amenorrhea. Okay, reports cyclical lower abdominal pain with imperforated hymen. So this is very, very important. Imperforated hymen. Which of the following is most likely diagnosis? Okay, directly we can come, that is the cryptomenorrhea. Cryptomenorrhea is the right answer. The next question, a critically ill patient on a ventilator becomes agitated, Okay, and attempting to pull out the IV lines and endotracheal tube. What should be the nurse's priority action? Okay, priority action. So here we can see apply the restraints to prevent the self-harm and accidental extubation. Yes, we have to prevent the self-harm and accidental extubation. So we have to take the consent for the restraint. And one more thing, they may ask you the question, this consent valid for 24 hours only, 24 hours only validity. Okay, so this is the right answer. So maybe they may ask you in the NORCET mains. Okay. Next question. A patient is on mechanical ventilator intubated with tube number 7.5 mm. Okay. And patient GCS as follows E4 VT M6. Okay. Suddenly ventilator started give high priority alarm, high inspiratory pressure after chest auscultation for bilateral equal air entry. So this is very key point. Okay, entry present. A nurse observed that alarm, try to intervene the condition. Okay, administer sedation, reintubate, tracheostomy not indicated now. Okay, then suction and clearance. Suppose if bilateral air entry is not equal, suction is the priority. Okay, but air entry is there. So administer the sedation is the right answer. We have to sedate him. Patient is not coping with the ventilator, that's why it's coming the high pressure alarm. So we have to administer the sedation. Okay, and then a patient admitted in MICU. Okay, so diagnosis of OP poisoning. Okay, patient assessed for CAM score, that is the confusion assessment method. Okay, confusion assessment method score, CAM score. Okay, confusion assessment method score. So CAM score is positive. What is the appropriate nursing management for CAM positive patient? Okay, so here we can right answer is a reorient. Okay, and involve the family. Yes, family should be involved because some positive means he may like mild, okay, stage of the uh, delirium. So he is not stable. Okay, so administer sedation, no, we cannot administer. Okay, transfer out the patient here, no, this is absolutely wrong. In teaching the patient, okay, about the ward routine, no, this is wrong. So reorient, we have to once again reorient should be done, and also we have to involve the family. Family should know the condition of the patient. Okay, and a patient behavior is considered to be secondary thought patterns. Secondary thought patterns. The nurse aims to modify the patient's behavior by changing their thoughts about themselves. Okay, which psychological theory, okay, theory does this approach represent? So cognitive therapy is the right answer. Okay, cognitive therapy is the right answer. Next question, a scenario described a child showing steady increase in height and weight along with the progressive development of the motor and cognitive skills. Okay, which principle of growth and development does this illustrate? So this is right answer, cephalocaudal and proximo-distal development. Okay, so this class also available in the KNO Academy app. And a patient with COPD is agitated, arterial blood gas shows PaCO2 75 mmHg, and patient is receiving O2 10 liter per minute via mask. What is the priority management? Okay, if he is receiving 10 liter per minute till his PaCO2 is high. Okay, so what can be done? So according to continue oxygen therapy and monitor, administer bronchodilator and prepare for the endotracheal intubation and encourage the deep breathing exercises. So here the prepare for the endotracheal intubation is the right answer. We have to prepare for the intubation. Okay, and next question: a febrile child is suspected of having UTI. Okay, urinary tract infection. Which is the best method to collect the urine sample for accurate culture? Collect the urine from diaper? No. Okay, midstream clean catch urine? No. Okay, because he is a child. Okay, and ask mother to collect the any urine sample? No. And urinary catheterization? Yes, urinary catheterization is the right answer. For urine, okay, examination, CUE, complete urine examination, we can take the midstream urine, but for not for the culture. Okay. And a female patient reports that she is experiencing abuse from her husband. Okay, as a nurse, which action best empowers and support the patient? Option A, ask, have you discussed with the, see, these options may be some difference will be there. Okay, so ask, have you discussed with your family? Okay, and ask, okay, can you explain why the situation is happening? And provide the helpline number, that is the woman helpline number, and this is the right answer. Okay, this is the right answer. And next, option D, explain the consequences of this is no. Okay, and then a patient is 3 hours post CABG surgery. 3 hours post CABG surgery. Chest tube drainage has been consistently, okay, 250 ml per hour for past 3 hours. And the patient, okay, now presents with the hypotension. This is a key indicator. Okay, what is the most likely cause? Fluid overload? No. Cardiac tamponade? No. Post-operative bleeding? Yes. This is the post-operative bleeding. Okay. Pulmonary embolism? No. Suppose in this case, if the primary nurse's role inform the physician or inform the doctor, so that would be the main, that will be the priority action. But there is no option. That's why it will be post-operative bleeding. A patient who is athlete. So this is very, very important. Athlete came with fatigue and dizziness. BP is 110 by 80 and heart rate is 52 per minute. What is the priority nursing intervention? Bradycardia. So bradycardia is there. We have to administer atropine and inform physician as bradycardia. Okay. It's a normal finding and continue observation. Monitor for dysarrhythmia. Yes. This is the normal finding. Okay. You can check the athletes. Okay. Even I also shocked once. Okay. We checked. There is only 40 to, okay, 50, their heart rate will come. Okay, just because of due to increased vagal tone and cardiac efficiency due to regular physical exercises. Okay, so because of this, okay, there will be presence of bradycardia. So no need to administer the atropine. Okay, right answer is a, it's a normal finding. Next question is, you are posted in a substance abuse disorder psychiatric ward. What is the primary plan of care in nursing care plan for the substance abuse patient? So they are asking a psychiatric ward. What you are doing? The right answer is managing withdrawal symptoms. Okay, we have to manage the withdrawal symptoms. Okay, adhere to long-term management. Okay, that is also okay. But main thing should be we have to prepare for the managing withdrawal symptoms because patients are admitted substance abuse patients. Okay, so they may involve with the withdrawal symptoms. Okay, this is the right answer. And next, so we'll come to the non-nursing questions. So non-nursing questions also we have collected total 20 questions. Many questions come from the KNO test series. Okay, I have got the test, I have got the feedback from our students. Okay, even I have the screenshots. Okay, so many questions. This question also included in our test series. Okay, who is known as the Missile Man of India? This question repeatedly they are asking question, that is none other than Dr. APJ Abdul Kalam. Even first standard students will tell this. Okay, this is very, very, this time very deadliest questions came in the NORCET. Okay, the synonym of vindicate is justify. These other three options we did not get. Okay, so the right answer only we got, that is the justify. And where is the UNESCO headquarters located? That is Paris, France. Okay, Paris. And the Sputnik 1 satellite, the first artificial Earth satellite was launched by which country? That is the USSR. That is the Union of Soviet Socialist Republics. Okay, Union of Soviet Socialist Republics, USSR. Okay, I don't know, maybe many people have done wrong this. Which state has largest coastline in India? This is also repeated question and also it is came in KNO test series. Okay, so that is the option one, Gujarat. Okay, and that next question, correct the below sentences. So here we can see neither the boys had done the work. Okay, neither the boys has done the work. Okay, here had has is there. Here neither of the boys has done the work, or neither of the boys had done the work. So here the right answer is neither of the boys has done the work is the right answer. Okay, neither of the boys has done the work. Then the idiom break the ice means the right answer is to relieve the tension. Okay, to relieve the tension or relaxation. Okay, so this is the right answer. Then question number 8. Who built Jama Masjid in the Delhi? So that is the Shah Jahan. Okay, this everyone knows. This also question asked in KNO test series. Simply I'm not telling. So what are the questions came in the test series I'm telling. Okay. All questions I'm not telling. Okay. Shah Jahan. And certain code. This I have only done in KNO Academy YouTube channel. It is there. Okay. I have done I think 8 to 9 months back. Okay. It is there in the KNO Academy YouTube channel. So coding and decoding in a certain code. Actually what people told. So this is the right answer. I'll tell you. But instead of I, they given J. Okay, maybe they have given typing mistake will be there. Okay, so in a certain code, this is very easiest only. Clock is written as DMPDL, and then watch is coded as. Okay, suppose I'll show how to solve this question. Clock. Okay, C after C, D has come. Okay, L after L, M has come. Okay, LM. Okay, after O, O means OMJKLMNOP. Yes, P come. Okay, after just one letter only, difference is there. Then after C, okay, then one letter. C means again D. Yes, K means KL. So plus one letter is added here. So same thing like only watch. So here we can see after W means X. Okay, A means B. T means U. Okay, then C means D. H means I. I should come, but instead of I, they have given J. So that's why many people have got confusion. Okay, but anyway, this will be the right answer. Okay, the next, the school of Shantiniketan, okay, opened by Rabindranath Tagore, is situated in which state? Okay, that is the West Bengal. Right answer is West Bengal. And then the function key is commonly used to refresh. Okay, refresh to reload the web page is most web browser is F5. F5 is the refresh key. Complete the series. So this is also very easy. Okay, 2 4 ja, okay, 2 2 ja, 2 2 ja 4, 4 2 ja 8, 8 2 ja 16, 16 2 ja 32. So this is the right answer. Okay. The next question: who was the first female governor of India? So this is first standard students will tell, that is the Sarojini Naidu. And then which is the antonym of the transparent? Okay, is opaque. Transparent is opaque. Okay, so opaque means full completely white. Okay, it's not transparent. Okay, and next question, this is very important. Okay, this also I have done direction problem, you can see in our YouTube channel. Okay, direction, decoding, color coding and decoding I only done. Okay, in YouTube channel. Okay, previous videos you can watch. Okay, a man, all the types of questions I have explained. Okay, a man walks 2 kilometers towards north, then 3 kilometers to east, and then 2 kilometers south. Then how far is from the starting point? So before this, what we should learn from this is, see, like this we have to mark a like direction. It should be always north, it should be south, it should be east, and it should be west. Okay, so now the person is walk towards the north. So this is the north. So now he started north, that is 2 kilometers. Then 3 kilometers to east. Then again he turned here. Okay, 3 kilometers is there. Then again 2 kilometers to south. So south will be down. So south 2 kilometers he has done. 2 kilometers. So now we can see the distance between from, okay, point A, like you can see C, okay, D. So distance from point A to D. So this is the starting point. Okay, so here we can see that is 3 kilometer, so this will be same 3 kilometer. Okay, so the right answer is the 3 kilometer. Okay, so hope you understood. This is very easiest one. And fill in the blanks. Okay, the boy was absent because he was ill. Because he was ill. The right answer is because. Find the odd one. So there, uh, circle, triangle, rectangle, square. So here the right answer is circle. How? See, this is the triangle. So it contains angles. Okay, even rectangle also contains angles. Okay, and square also containing angles, right? But circle doesn't. So that's why circle is the right answer. Means ಗುಂಪಿಗೆ ಸೇರಿದ ಪದವನ್ನು ತೆಗೆಯಿರಿ. Question number 18. Change the following sentence into the indirect reported speech. Indirect reported speech. So that is the direct speech. So here they are given. So he said, I am busy now. He said, I am busy now. So what is the indirect speech? So right answer is he said that he is busy now. He said that he was busy then. Okay. He said he will be busy now. He said he is busy. Okay. The right answer is he said that he was busy then. He was busy then is the right answer. Then question number 19. Java program. Okay. Java programming language was developed by which company? So this is the Sun Micro Systems is the right answer. Sun Micro Systems is the right answer. Okay. Which one of the following can be used as output device for a digital counter? Digital counter. So output device. So input device, output devices. This question has came in KNO ACADEMY. Okay. Output. So here we can see input to so all the printer is the output actually. Okay. Printer. Okay. So keyboard. Okay. Scanner, mouse. Okay. Everything will be input only. So output will be printer, speaker. Okay. So like this are the what output devices. So here the right answer will be printer. So hope you all got the 100 questions. You can count the 100 questions. Okay. If you have any doubts, you can comment this. Okay, because some of the options may vary from the original paper. Okay. So thank you all.